Hello and welcome to this brief presentation on Ketorolac, also known as Toradol. This training has been designed to familiarize Michigan's Southeast Region paramedics with the administration of Ketorolac when indicated by protocol. This training applies to all paramedics that provide care in any of the Southeast Region medical control authorities. By the conclusion of this brief presentation, you will be able to identify the location of Ketorolac in the Southeast Michigan drug box, as well as how it may be packaged. Describe the pharmacokinetics and pharmacodynamics of Ketorolac, list the indications and contraindications of Ketorolac, and finally describe how to administer Ketorolac, as well as list the applicable medication concentration, route, and dose per the applicable state EMS protocols. As of June 1, 2018, Ketorolac, more commonly known by its brand name, Toradol, is one of 4 new drugs that have been added to the Southeast Michigan regional EMS protocols. The addition of Ketorolac offers a therapeutic alternative to opioids when managing patients complaining of mild to moderate pain. Beginning June 1, 2018, one vial of Ketorolac containing 15 milligrams in 1 milliliter will be located here on the second shelf of the Southeast Michigan drug box in the same compartment as the ipratropium bromide. This location was chosen due to its close proximity to other pain management medications. Ketorolac will not be supplied in the Southeast Michigan APACs. Ketorolac is an injectable, non-steroidal, anti-inflammatory medication, or NSAID. It belongs to the same family of medications as aspirin, ibuprofen, and naproxen, but Ketorolac is much more effective at managing pain than other NSAIDs, and its onset of action is quicker. Ketorolac's therapeutic effect is due to its ability to block the production of inflammatory chemicals in the body, decreasing swelling, pain, and fever. Its anti-inflammatory properties make it ideal for managing mild to moderate pain due to injury. However, Ketorolac may be used for both inflammatory and non-inflammatory causes of pain. Ketorolac may be administered via slow intravenous or intramuscular injections. It should be administered to patients suffering from mild to moderate pain, rated from 1 to 4 on the Wong pain scale. Pain relief will begin approximately 30 minutes after Ketorolac administration for both IV and intramuscular routes of administration. Remember, Ketorolac is for patients complaining of mild to moderate pain, in other words, uncomfortable but tolerable pain. If the patient is unable to tolerate their pain until the onset of Ketorolac, consider another more appropriate form of analgesia per the pain management protocol. Side effects from low-dose Ketorolac are unlikely. With that said, EMS providers should monitor for side effects following Ketorolac administration, which may include abdominal pain, nausea, indigestion, and headache. More serious side effects can occur at even higher doses, taken over several days, including GI bleeding, ulcers, anemia, and prolonged bleeding. Again, Ketorolac should be administered to patients experiencing mild to moderate pain, rated from 1 to 4 on the Wong pain scale. Due to its great ability to relieve pain from kidney stones, Ketorolac should be considered a first-line medication for pain known or suspected to be due to kidney stones, regardless of pain scale score. In contrast, there are contraindications for Ketorolac, which include a known allergy to Ketorolac, or other NSAIDs like aspirin, ibuprofen, and naproxen. Ketorolac should not be given during pregnancy, active labor, or to women who are breastfeeding. Do not give Ketorolac to patients who have a history of impaired renal function. In addition, do not administer Ketorolac to patients who are at high risk for bleeding, such as patients with a history of GI bleeding, ulcers, or other related perforations. This includes patients that are on blood thinners, such as warfarin or Xarelto, which may increase chances of bleeding. Finally, do not administer Ketorolac to patients that already self-administered NSAIDs for their pain. Per the pain management procedure, administer Ketorolac 15 milligrams intramuscular or IV to patients experiencing mild to moderate pain, rated from 1 to 4 on the Wong pain scale. For pediatric patients, administer a weight-based intramuscular or IV dose of 1 milligram per kilogram up to a maximum dose of 15 milligrams. To administer Ketorolac, remove it from the drug box. Remember, Ketorolac has not been added to the Southeast Michigan APAC. Next, verify the correct medication and dose. Ketorolac is supplied in 1 vial containing 15 milligrams in 1 milliliter. Remember, the adult dose is 15 milligrams intramuscular or IV. The pediatric dose is 1 milligram per kilogram with a maximum dose of 15 milligrams. Assure you do not confuse Ketorolac with ketamine. Ketamine is located with the other controlled substances in the Southeast Michigan drug box. Next, prepare the needed supplies to drop the medication from the vial, which include a syringe, needle, and alcohol prep. Remember, Ketorolac can be given intravenously or intramuscularly. When administering Ketorolac intravenously, assure the medication is delivered slowly, over at least 15 seconds. Rapid administration may cause bradycardia. Follow the IV administration with a 20 milliliter saline flush. When administering Ketorolac intramuscularly, assure the drug is delivered slowly as well. Preferred sites for IM administration include the deltoid and lateral thigh. After administration, monitor the patient for pain relief and/or side effects. Remember, following Ketorolac administration, the onset of pain relief is approximately 30 minutes for both IV and intramuscular routes of administration. All medications located in the Southeast Michigan Drug Box and APAC are described in Section 9 of the state protocols. In Section 930, you'll find that information is provided regarding Ketorolac, which includes a list of all applicable protocols, indications, contraindications, dosing, expected effects, and side effects. Finally, it's important to know that the MyMedic cards have been updated to include Ketorolac. Contact your EMS coordinator to obtain an updated version of the MyMedic. This concludes our presentation of Ketorolac for Michigan Southeast Region Paramedics. Contact your EMS coordinator or Medical Control Authority with any questions regarding the information presented in this training. Have a great day.